Hello, my name is Dr. Phil Davies and I'm a GP in Hampshire. I'm speaking to you from my practice. We have started a website called thevirus.uk and it is there to deliver medical information to our practice population. But it is also intended to apply to the wider UK population. On the front page of that website there is a link for video advice for the young, and then there's an alternative link, video advice for the older. Now this particular video is concentrating on that latter group, our elderly patients, patients over 65 years. Patients in that group are slightly more vulnerable to this particular virus. So what I want to talk to you about today is 1, how you may avoid getting the virus, 2, how you may know that you contracted the virus, 3, when would you think it's right to phone for a medical professional, 4, the sort of things that a medical professional on the end of the telephone will want to know from you, the questions they will ask, 5, what are the criteria that the healthcare professionals generally will use to decide what is the best treatment for you. And then finally, I'll cover things you can do yourself to make yourself more resilient to this virus. So first up, what do you do to avoid getting the virus in the first place? Well, you should know this already. Meticulous hand washing using soap and water, liquid soap or solid, or alternatively high concentration alcohol gel. The other thing you're familiar with is social distancing, maintaining at least 2 meters between yourself and others. And for those who are especially vulnerable, social isolation, staying at home. Obviously, we need to ensure that you have good support in order for that to work. But what are the symptoms that might tell you that you're getting the virus? Well, the most common is a persistent dry cough and fevers, feeling hot and sweaty. Now, those symptoms in themselves don't mean you need to contact a doctor or a nurse, but there are some symptoms that we'd be more concerned about and we would think would lead to you trying to phone for a medical professional. So, this is a respiratory virus. It affects the chest primarily, at least in the initial stages, and therefore if it's getting worse it will tend to affect breathing. You will get breathing difficulties. So if you find yourself in a situation of finding that the normal activities you would do around the house are a bit more tricky because of breathlessness, then I think you should be phoning for medical assistance. Other things that might trigger you to phone for us would be if you're feeling that you're getting a bit more muddled and confused. I think you may need assistance at that point. Other things, chest pain. Obviously you would have to call for medical assistance in that case. So when you speak to the medical professional, it will either be via 111, which is the NHS service, or potentially if you have an on-call GP and it's easy to access, then phoning direct to your GP or out-of-hours service will also suffice. Our practice is looking to start providing 24/7 out-of-hours cover for our patients to help with the NHS 111 system. If your practice isn't doing that, then NHS 111 is the default setting if you're getting worse. So the sort of things that the healthcare professional on the phone will want to investigate is, as I've said, are there activities that you were previously able to do that are now getting trickier because of perhaps breathlessness? They will want to know if you can talk fluidly in full sentences or whether it's interrupted by breathing. There are some values they would want to know. They would like to know your respiratory rate, your breathing rate, how many breaths you take in a minute, and they would like to know your pulse rate, your pulse over a minute. Now, our previous videos on the website will show you how to take your pulse rate, how to take your respiratory rate, and I'd like you to look at them because I'd like you to be able to record those values now when you are well, and record that, and that will enable you to then take those values again when you are unwell, just before you make the phone call to the doctor or nurse. Now when you take those values, try your best to calm yourself. Obviously, when you're about to phone a healthcare professional, anxiety might kick in, and it tends to raise those values and give a false reading. So try your best to calm yourself and get the most accurate reading for pulse rate and respiratory rate. Other things we might be interested in are things like the Roth Score. Now that's something that is based around your ability to take a deep breath and then count towards 30. And we like to record what number you're able to get to before you have to take a breath and how long it took you to get there. Now that test has been slightly discredited recently, but it could still be useful if you can do that test now when you're well, and then we can compare that to when you're unwell. One of the videos on our website describes how to measure your Roth score, and that could be useful to us as well. Other things that would be useful is if you're a diabetic, we'd like to know what your blood sugar is. If you happen to have a blood pressure machine at home, yep, we'd like to know your blood pressure. If you have a thermometer, your temperature. If you are asthmatic or you've got COPD, chronic obstructive pulmonary disease, this is a peak flow meter. You should have one, and we'd like to know your reading when unwell and also compare that to when you were well. We would like to know also who is there to care for you and support you in your home or nursing home environment. Now we would then also explore your expectations of what you think we should be doing for you. We will then be able to form an opinion of whether you're best managed at home because things aren't too bad, or whether we need to see you face to face in an interview, or whether we need to refer you straight to hospital. Now, one of the other criteria that ourselves and certainly the hospital doctors will want to know is the clinical frailty scale. So clinical frailty is a means of measuring your degree of robustness, and it ties very closely with how likely you are to do well in an acute hospital care setting. Now, this is a controversial but important area. Ventilators in hospital are a finite resource, and they are not suitable for absolutely everyone for good reasons. So I will say this: the government has not yet given clear instructions on how to triage patients for the various types of treatment available, things like ventilators, CPAP, or supplemental oxygen. But the National Institute of Clinical Excellence, NICE, has given guidelines on a framework for us to apply to this situation. And it is based upon the likelihood of certain patients getting through ICU and out the other end to live some productive months with their family. And it's based on this clinical frailty score, which goes from 1 to 9. Now 1 is fit and well, very active, running, jumping, skipping. It goes all the way to 8, which is extremely frail, bed-bound mostly, and completely dependent on carers and quite unstable, not with a long life expectancy. Group 9 is a separate entity, and that is for people who are terminally unwell with a less than 6 months life expectancy. That's a separate group. Now, this whole framework is useful when applied to the elderly population, that being over 65, but not to patients who have got chronic, stable disabilities or learning disabilities. Such patients need a more focused, nuanced approach, and that must be done by the healthcare professionals. But as an example, patients in the group 1 to 4 are thought to be very suitable for ICU, the use of a ventilator, should they clinically need it. So group 4 is a patient of any age who is still independent but has slowed up quite a bit, maybe uses a stick to help them walk about, but they're still pretty independent and not overly reliant on any others. Those patients, if they're sufficiently unwell, should be put forward for treatment in intensive care involving a ventilator, because they stand a good chance of getting through that and out the other side to spend time with their family. In the next group down, these are patients in groups 5 and 6 of the Frailty scale, are mild to moderately frail. Now they are 2 to 3 times worse in terms of prognosis compared to the groups 3 and 4. They have a 2 to 3 times more likely to die in the hospital, an even worse chance of progressing into enduring months of health afterwards. Now those patients can sometimes be placed on ventilators in intensive care, but that's not always the case. They may be suitable for CPAP, which is constant positive airway pressure, which is a tight-fitting mask and high-flow oxygen, which makes it easier for them to breathe. That would usually be done in a high-dependency unit or a respiratory ward, but such patients may do well in that situation. Now, patients at the scale of 7 or worse are not suitable for intensive care. These are patients who are almost completely dependent on others, on carers. They're largely bedbound. Now, their frailty is such that they are 4, 5, 6 times poorer in terms of prognosis for going through the intensive care treatment and coming out the other end. Therefore, in a pandemic, patients who are in the top 4 groups should really be selected for ICU treatment. And I'll give you an example. A patient aged 75 who is completely dependent on carers and largely bedbound is 5 times or 3 times less likely to survive than somebody who is grade 4 in the frailty scale, someone who walks around with a stick but is largely independent, age 75. So there's a big difference, and therefore that's the sort of screening criteria that's used. It is not appropriate for relatives or the patient themselves to bump up their physical capabilities, saying that just 2 weeks ago they were able to walk up 5 flights of stairs no problem when actually they're largely bedbound is inappropriate, because there's a real factor to consider in terms of the hospital experience. Patients are selected for intensive care and they are largely anaesthetized and are mostly unconscious, and so not able to receive messages via the nurses in intensive care, taking messages from the family to the patient. They're unlikely to receive that particularly well. There may be windows of opportunity, but it's unlikely. Whereas for patients on CPAP in the respiratory wards, or patients on supplemental oxygen, little nasal specs with oxygen coming in, they'll be lying in the more general wards with general nursing care. And in those cases, relatives will be able to get messages passed to the patient via the nursing staff, and maybe a relative can don full personal protective equipment, PPE, and actually come in and sit with their relative for a while. That really is not possible in ICU. So the most appropriate treatment for that patient needs to be decided, and it's a difficult area, but I think it's important that you know about that and prepare for it. But obviously, we would prefer that you get through this without needing to come to hospital in the first place. And so there are some things you can do to make yourself more resilient to this infection. So, eating well, sleeping well, perhaps taking multivitamin tablets, perhaps taking a vitamin C tablet, chewable, once a day. It may add some protective advantage. Exercise does help. Moderate exercise on a daily basis. If you're not someone who does a lot of exercise and you're cooped up inside an apartment or a house, then just high knees walking, just doing this for 2 minutes, several times a day. That will get the heart pumping and get the lungs working. That's important. If you are a bit more active than that, then doing lunges or following Joe Wicks, that will be useful. Also, medications. If you're on regular medications that are prescribed, make sure you have a robust prescription so that you won't be running out when you get unwell. That's particularly important for inhalers, for asthmatics and people with COPD. But other things you can do to increase your resilience. If you have COPD or asthma or bronchiectasis, then you can practice breathing exercises which help the lungs become prepared for an infection. One thing you can do is pursed lips breathing. So that's like breathing through lips that are shaped for a whistle. Doing that for a few minutes, several times a day, can be helpful at expanding the lungs. You're breathing out against a bit of pressure. Obviously you stop if you feel a bit lightheaded, because that can happen. There is a video linked to from our website that will show you how to do that. There's another thing you can use to enhance that technique, and these are devices called positive expiratory pressure devices. And I prefer the oscillatory vibrating positive expiratory pressure devices. These are little devices you breathe into that give resistance and vibrate at the same time. My own favourite for patients is this one, the a cappella, but there's also the cornet and the flutter. So essentially, it's shown in one of our videos how you use this, but you can use it in any position, and essentially you breathe out slightly harder than you would do normally, and you breathe in a bit harder than you would do normally. A bit like blowing up a balloon. The vibration there helps loosen secretions if you're prone to secretions. And then you try and huff up a cough after you've done that maybe 20 times. And that cough can expel mucus, but can also expel virus. So it's a useful thing to do. The resistance that you feel when you're breathing out, that also helps expand the lungs, stops them collapsing. So we've tried to cover various things that you can do to make yourself more robust. Thank you.